Hi, I am Chandrima Manocha. I am a speech language pathologist and I work with children across the entire autism spectrum, as well as other speech and language disorders like cerebral palsy, cleft palate, Down syndrome, apraxia, and many more. So my goal has always been to really work on finding their voice, giving them a mode of communication, as well as empowering parents so that they can take it back home and work with their children, and also encourage communication in everyday life. So today we are going to, talk about some common concerns. Mostly the concern that, parents have is my child with autism going to express himself, express their emotions, communicate, engage with the world around them with the help of speech therapy. So I'll be answering some of those frequently asked questions about speech therapy in autism. So the first question is, what is speech therapy and how does it help children with autism? So this is, definitely the first thing parents want to know. What is speech therapy? Or if a professional is referring to us, they want to know what happens in speech therapy. So when parents come and ask me, they come with the thought in their mind that speech therapy is to make the child talk, right? But speech therapy is more than that. What is speech? Speech is the sounds, the words a person uses. It's the production of sounds. But when we talk about speech therapy, let's put it as more as speech language therapy or communication therapy, because we are really focusing on communication, which is the broader picture. So when a child comes for speech therapy, we are working on many different skills depending upon where the child is at. So it's not one formula fits all. Right? If a child has come, first we do the baseline and we figure out where the child is and how to help them beyond that. So for example, we might be working on teaching them gestures or bringing into picture communication, or it could be they are at one word level and we are expanding their utterances. It could also be they're learning to use speech generating devices to express themselves beyond just, some keywords here and there. So it could be various areas that we are working on. And then, speech therapy is a little more than just showing them pictures, right? Because again, I told speech therapy is communication. So for communication, we have to go beyond pictures. We are using various activities like play-based or people-to-person interaction. For example, it could be a tickle game. It could be run and chase. It could be balloons, bubbles. It could be any of those fun play-based activities. Then we can also do some cause and effect kind of play. So there are various activities that we do in speech therapy. But then to take it to back to home, we also, and that I'm going to talk about further, but it's also to take it back home, we can work on everyday routines, just day to day. When a parent is interacting with their child, we can incorporate some of the strategies we teach them in speech therapy. So when we look at it in a bigger way, we are giving them verbal as well as non-verbal means to express themselves. We are empowering parents to be able to connect with their child and support their communication and their speech language development. We are also helping them, together working with them to find the strengths and tap into those strengths and expand on them. So that's what is, when we talk about speech language therapy with children with autism. So the next question: what are some of the earliest signs of communication differences in children with autism that parents or caregivers should look for, right? This is also, again, a very important area because we all have heard early identification, early intervention. The only way that it can happen is if we identify those subtle signs. Because, believe it or not, the concept is still there that if a child is not talking by 1.5, 2, it's okay. The child will outgrow it, or that particular child's, one of the parents have started talking late, so it's fine. When the mother expresses concern, sometimes she's told you're overanalyzing. So these are still very common. And still, I feel that if I can, talk about some of those subtle signs that are those signs of, there can be a speech language delay or those subtle signs of autism, do look, for it if you have, and then consult a professional. So the common ones that we hear is the child does not give eye contact. But when parents come to me, sometimes they have said, no, my child was giving eye contact before, so there was no way we could know. That's true. So that is why, we do look for it, but some children with autism may have eye contact even in the really early stage of development. And later, you will see that eye contact is a concern. There's also, another 1 or 2 very critical points, like they do not point to things. This is very critical. Now, what does it mean? Because when I ask parents during the first session, right, that did your child as a baby point to things to show interest? They would say, yes, they pointed. But then when I asked more specific questions, did they point to it, or did they take you to that object or reach for that object instead? Then they would say, yes, that's what my child did, not really using their index finger, pointing to what they're interested in, and then looking at me and trying to get my attention. So pointing is the first sign of joint attention. They're building that attention to share their interest with their caregiver, mom, dad. So it's basically almost telling, look, I've seen something, look how interesting it is. Do you see it? That's pointing. So definitely, there is, this skill is lacking in the early signs. This is a very subtle early sign that we look for. So there are children who have expressive language delay, but not autism. So you will see those children, even if they are not talking, they'll be using a lot of variety of gestures. So they'll say like this if they are hungry, they'll show like this if they want somebody to come, very specific gestures and variety of them. But children with autism in the earlier years, in the earlier stage of development, they will not use a variety of gestures. Some may start to wave, bye or hi, but a lot of them don't even do that kind of gestures. So gestures are missing, pointing, eye contact, responding to their name consistently by turning and looking at the person who called their name, following instructions. So from a very early stage, like 1.5 years, children are following simple instruction. Give me the ball, put it on the table, without us having to use our hands and showing them what we want them to do. Just by listening to us, they'll be able to follow. But children with autism, you will see, following instruction is difficult for them. By 1.5 years, they start, usually children will start saying words, right? Meaningful words for communication. But children with autism, you will see that they aren't using meaningful words. They might sing rhymes, they might say the entire alphabets, but parents will come and say, he can say his alphabets, he can sing rhymes, but he will not use any other word for communication or interacting with me. Those are the early signs that we need to look for, and then consult. And after the consultation, the speech therapist will tell you, whether the child needs therapy, whether there are some strategies you can follow at home, is it of concern or not. They'll help you make that decision then. So for early intervention, I think it's very important to look for these subtle signs. Next, another interesting question that has been asked is, can speech therapy be done at home? And how do I start? Again, very, very important question. Why? Because communication begins at home. So any child you look at, they will start communicating at home with family members, friends, and their environment. They explore their environment and their surrounding, and they learn language, right? So for children with autism as well, I think therapy can be done at home. How? It's our role as speech-language pathologists to again empower parents with practical strategies that can be used in everyday routine. So everyday routine is almost the powerhouse of creating communicative opportunities for our children, right? How is what I'm going to talk about a little bit. So everyday routine means bath time, meal time, they're getting dressed. It could also be you take them to park every day. So everyday routine can be anything that you are doing as a routine daily. Why is everyday routine important? Because it's repetitive. We are doing daily. Number 2, sometimes it happens more than once a day. Number 3, if we can build communicative opportunities in these daily routines, we are giving them ample opportunity to communicate with us, to interact with us, and to connect with us, which is very important for their constant speech and language development. So, for example, we are going to take everyday routine, and there is snack time. Right? For snack time, mostly what we will do is we will take their favorite snack. For example, it's apples or it's matri, anything, whatever is their favorite snack, right? Out of that, some are healthy snacks, some crave for junk, but as parents, I know we try to give them a balanced or a healthy option. So we just place it in front of them and they are eating. Is there much communication that happened? No, right? I just offered them and they started eating and they are busy eating. So there is no communication. But just in this situation, for example, we can give a choice of 2 snacks. 2 snacks that you would want your child to eat and is also their favorite. And you give a choice and wait. Which one do you want to eat? So what happens? We automatically give them a chance to connect with us and interact with us. So they will look at the snack that they want probably, or they will reach out for it, or they will point to it, or if they are at one word level, maybe they will name it, right? So automatically we built in a communicative opportunity. So amazing. Now, once they have indicated what they want, we give them a little bit of it rather than the entire bowl, and part of it is with me. So what will happen? They will eat their snack. Once it's over in their bowl, because it was just a little bit, and the rest of the snack is in my hand, they'll again connect with me. They look at me, or they look at the snack, or they'll try to reach for it. In some way, they will indicate that they need some more. So communication is what? Gestures, pointing, body language, through eye contact. In any of these ways, or a word, your child is interacting with you. And you're able to build those communicative opportunities so easily in the everyday routine. So you see how powerful everyday routine is. Now, it could also be, just to show you how the variety of vocabulary that is there in everyday language, in everyday routine. For example, bath time, right? What are the different words that we can highlight or talk about? It could be the nouns like soap, towel, water, tap, right? We can also talk about various action words like open the tap or rub your hand. So there are many, action words. Splash, splashing water. It could be talking about the, temperature of the water, like so cold, let me make it warm. So you see, just one routine gave you the variety of vocabulary. Just focus on some of these keywords. So how to go about it, how much to target, how to teach them is what speech therapist then helps the parents or empowers the parents to work on it. So everyday routine is, through giving choices, by giving little by little, by talking about the various things in their environment. Either we are naming that object or making a simple phrase or a comment about it, like giving an instruction, like open the tap, water is cold. So you hear that there's so many different ways we are making it a language-rich environment for the child. And also, I think a very important thing in the way that parents can do speech therapy at home. And these are just small ways, then based on individual child needs, the speech therapist will be able to guide you. But to join in their fun, to join in their activity, even if it seems, things that we call repetitive, stimming, we have to join in. If they are spinning, you turn around and you can sing Ring Around the Roses and make a game out of it. So there is no limit to how much we can do at home, because we have to remember communication begins at home. It's the most it's the most comfortable environment for them, and that is why learning happens faster. So let's look at, the other question. What activities or tools can I use to support my child's speech development? Again, a great question, because sometimes parents wonder, how much time do I have to give for speech therapy activities at home? Or what are some toys that I have to buy? Sometimes we don't need any special toy. It is just the everyday routine. But yes, just like any other child, there are various activities we can do with also, with our neurodivergent children. So anything that is age appropriate for that child. Like I gave some examples. It could be balloons, bubbles, puzzles, blocks. But remember that it can be played in an unconventional way at first. So if your child plays it in a certain way, you can join in and slowly build on other ways of playing with it as well. Because once you join in, they allow you to connect with them and they are able to connect with you. And then the exchange and the two-way interaction happens beautifully. So yes, there are several activities and tools, but remember, you have to make it age appropriate. So a 10-year-old coming to me, I may not do stacking cups, even though they may not be able to do 100% of the time. That's okay. I have used, toys like superhero figures for older kids, or it could be, they love poems and learning songs and poems. I have, used that as a mode of interaction with them. So it could be anything that they're interested in. So observe your child, see what they love doing, do more of that, and introduce some other age-appropriate toys. But keep it interactive, and your speech language pathologist will also help you figure out how to use certain strategies to add communication to that activity. But other than toys, there are songs that you can do imitation with, motor activities, various everyday routine, or playing out in the park. Any of these can be used for teaching communication. So the next question is, can speech therapy improve social skills and emotional regulation in children with autism? Again, this is a great question because social skills and emotional regulation is not just worked or targeted in older children or older individuals. It starts right from the beginning. How? For example, a child is unable to put the shape in the shape sorter or stack the cup. What will a child do? Probably they will just throw it because they could not do it and they were frustrated, right? This is where in speech therapy, what will we do in this situation? We will teach them to either do a gesture for help or show a picture that has the word help on it, and encourage them and support them to communicate their feelings, right? Or ask for what they need, ask for help. Immediately, as they learn, you will see they are not throwing that toy anymore. They're asking for help, right? Gradually, as they learn to do it. So what did we work on? Emotional regulation, right? Or a child doesn't sit through activities or participate in, activities that you're trying to do. What do? We offer breaks so that they're able to their sensory regulate themselves, right? And come back to whatever task is at hand or whatever activity they were doing. What did we teach them? Emotional regulation. In later stages in older children, we also use visuals, we use social stories, but we begin working on emotional regulation right from the beginning by teaching them various strategies and communication methods. But it's not just one-man team, it's always a teamwork. So an occupational therapist is also teaching them various calming strategies, right? So that they can choose from it when they are having a sensory dysregulation. So just various ways that emotional regulation, can be targeted or can be worked on. The same way social skills. As we are working on communication, that is the two-way interaction right from the beginning, we are working on social skills right from the beginning. So we are doing back and forth, we are doing turn taking in a play group or school. They are following instruction in a group. They're doing what other children are doing. They're also observing other children, how they interact with others. So all those are ways they are getting exposed to social skills and just gaining more and more experience and learning along the way, right? But other than that, there are various ways social skills can, be developed, whether it is through, again, doing small groups where children, are interacting with each other, doing an activity where they have to take turns. Social stories are used. Again, various ways in which the social skills are targeted right from the beginning. And if we focus on communication, if communication is our main goal, you will see that social skills takes, improvement happens in small steps over the long journey. So one more thing in terms of social skills and emotional regulation is the concept of just keeping in mind neurodiversity. With this new paradigm shift, I think what has happened is previously it used to be social skills targeting more, trying to make them fit in the society. But now it's more about teaching both sides. So teaching the peers and adults how to accept a different communication style. So it's not that they don't want to communicate, it's just that they communicate a little differently, right? And also giving ample experience and exposure and opportunity to the child with autism to see how social interaction happens or create social scenarios and help them just apply the various skills that they have learned in building interaction. So there are various ways that are used, but keeping in mind that we don't have to make them fit in. They can have their own individual preferences, and that's why I think neurodiversity has brought in a whole different mindset, and that's, I think, amazing. We have to keep that in mind and remember those little things. For example, I'll just give an example. Parents are more aware now that when a child is stimming or have a repetitive, behavior, it need not be stopped forever. They need it to regulate themselves, right? So that is why they are allowed to do that. Not even allowed, they do it when they need to calm their body down or regulate themselves. And if they are given that opportunity and option to do it, you will see they are better able to focus on their task at hand after that. So just simple things. Parents used to feel that in a public place, if my child starts doing, but now they don't, they try and they say that, I try to ignore that and let them do it for some time and calm themselves down. Parents are also taking them out for more trips, for public places, is just going to give them more and more exposure to sensory regulate themselves in all these situations. So what is the next? We'll just take a look. So what misconceptions do people often have about autism and communication? Yes, so there are many misconceptions. I'll try to point out some of the very important ones that makes our children with autism misunderstood in a lot of ways. So for the first one is they don't want to communicate. Well, that's not true. Several years back, I would say the concept was they are not social, they don't want to communicate, but it's very different. As I've worked with these children over the years, we are seeing that they do want to communicate. It's different. Initially, it's through their behaviors, gestures, body language. Slowly, we add on other communication methods, and they're able to communicate through that. They may not be able to always give you eye contact while communicating with you. They might be looking away, but that doesn't mean they don't want to communicate with you. So it's just done in a little different way. The other one is speech is the only form of communication. That's not true as well. Speech is just one mode of communication. There are many more, like I said, and I've highlighted that many times in some of these questions. It's through gestures, pictures, visuals. There are speech generating devices now, apps that are helping them find their voice. They're able to find their voice and express themselves much better. And they feel understood, right? So, yeah, it's not that speech is the only way. Communication has various modes. When people see our children, they feel they can't talk, means they don't understand, or they can't learn. But that is not true as well. Most of the children that I have seen and I have been with all have very good understanding. Once we work on it, of course, over the years, they are able to understand a lot of conversational topics that are going on. And so sometimes we talk about what they can't do more often than what they can do in front of them. And you will see parents have become more aware now. So they will say, he's getting restless because we are talking about him. So you see, they do understand. It's not that they don't understand. So we have to be mindful. We also have to talk to them about their strengths, talk to others about their strengths, and presume competence. I think this is very important. We have to presume competence. They are capable of learning. Many children that I work with have shown amazing growth in terms of their learning ability as well. But when given the right mode of communication, it need not always be picture for one. It could be an app, it could be speech generating device, it could be picture, it could be written mode, it could be verbal mode. So both verbal and non-verbal means if they have access to and they have been given that right from the beginning, they have shown amazing skills, whether it's about expressing their true emotion, whether it's about what they really, are thinking about, or even how much they know about themselves. Simple things like, what do you think you're good at? And sometimes through speech generating device, sometimes through written mode, sometimes through spell board, they are able to express, they have such good understanding about themselves as well. So it's amazing when given the right mode and paving the right path for them, how much they can actually learn. So presume competence, don't underestimate them. The final question, I think these are great questions, and definitely the things that parents want to know about. So the last question is technology and AAC. AAC is alternative augmentative communication. What's its role in speech therapy or in speech and language development? Now, technology is everywhere now, right? We all use. And it has become definitely a game changer and a boon for our children with autism. So both technology and AAC, they are very powerful tools that, to again clarify one more misconception, that if we introduce AAC too early, my child will not start talking or using verbal output. But that's not true. It actually paves the pathway for speech development. And as a speech language pathologist, we help parents understand how to incorporate this AAC or visuals or picture communication in their daily routine, and also help support their speech development hand in hand, right? So it is almost, when we use AAC with these children, it's almost that they find their voice. They find their voice and they don't have to wait for years to be understood by others or to be able to express themselves. So it's definitely, the more I use it, starting from an earlier stage, the more it opens my eyes to how much they have in them and how much can be done using total communication. So when we say total communication, it is various modes of communication. They should have the access to it, whether it's, again, I'll repeat myself because this is important, gestures, pictures, speech generating devices, typing skills, writing, spell boards. So many modalities are there to help them communicate and express themselves and just make themselves explore the world more. So when, in certain apps and speech generating devices, when they're exposed to vocabulary, it's amazing how they look at it and they're slowly able to use it for the right moment and the variety of words they use. It is really an amazing thing to see when they're able to do that. And just the look on their face when they are understood by others is, again, a very precious moment. So as we can see, that few things from these wonderful questions were that, speech therapy is definitely about communication. We presume competence in all our children. And it's very important to know that just because there is no speech output doesn't mean that they cannot learn to communicate, they cannot learn language, and they cannot interact with others. The other important point that we focused on in these was you can teach communication and language through any and every activity, whether it's play, toys, everyday routine, books, storybooks, and also giving them an opportunity for total communication. So as we can see, we are wrapping up this discussion today. And if you have liked the video, please like, comment, and subscribe to India Autism Center channel. And if you want to explore more videos and resources on autism and communication support, please don't forget to check out all the videos in your screen. Thank you.